Hi. On today's episode of Mama's Got a Brand New Bag, I want to talk about IBD, or inflammatory bowel disease. Not the textbook definition, not the lab values, but what it is and what it actually means to live with it. IBD is one of those conditions that many people have heard of, or they know someone that has it. But very few people actually know what it is. It's often invisible, misunderstood, and minimized, even though it can impact nearly every aspect of daily life. Whether you live with IBD, you love someone who does, you care for patients with it, or you're just curious, this episode is about understanding the whole picture, not just the diagnosis. So thanks for listening. IBD stands for Inflammatory Bowel Disease, and it includes conditions like Crohn's disease and ulcerative colitis. Crohn's disease is a chronic inflammatory disease. It affects any part of the digestive tract from the mouth to the anus, often referred to as gums to bum. Inflammation can occur in patches referred to as skip lesions and can penetrate the full thickness of the bowel wall. Symptoms vary, but often include abdominal pain, diarrhea that's sometimes bloody, weight loss, malnutrition, and fatigue. Because inflammation is deeper, Crohn's can lead to strictures, fistulas, and abscesses, which require a complex medical treatment plan. Ulcerative colitis is also a chronic inflammatory condition, but it affects only the large intestine, so the colon and the rectum. The inflammation is continuous, starts in the rectum, and spreads upward through the colon. It involves only the superficial lining of the bowel. Common symptoms include bloody diarrhea, urgency, abdominal pain, and fatigue. Because it's limited to the colon, symptoms and complications are generally localized there, but they can still be persistent and very life-changing. While IBD is considered a GI issue, it isn't just about the gut. It affects energy, nutrition, growth, mental health, relationships, work, and identity. While there are many symptoms associated with the diagnosis, each patient experiences a unique constellation of symptoms, which is what can make it so challenging to diagnose. Diagnosis is made by biopsies collected throughout the GI tract via endoscopy. Often, IBD can occur in a series of flares and remissions, of feeling okay one day and completely depleted the next. Sometimes, because symptoms aren't always visible, people assume you're fine when you are most definitely not fine. It's the kind of illness where you can look perfectly healthy on paper while internally negotiating with your immune system, like, could you just do your job today? Living with IBD means constantly assessing your body, sometimes consciously and sometimes without even realizing you're doing it. You think about bathrooms, where they are, which ones are good, and which ones you should probably wear a hazmat suit in before you go. You think about food, what will settle today, what sounds good today, and what will most definitely cause gastrointestinal distress. Is it worth it? You think about energy. Can I get through today without a nap or two? Why does everything make me so tired? You think about whether today is a push through it and get it done type of day, or a we should probably cancel everything and stay home in my jammies with peppermint tea type of day. You also worry that every little virus you pick up could be something new about your IBD. You're always on red alert, looking for a new symptom or a sign that things are starting to become inflamed again. There's also the mental load, countless appointments, labs, imaging, insurance approvals, and medication schedules. The hours spent on this alone are a full-time job, but I will warn you, it doesn't pay very well. Beyond the physical symptoms, there's a significant emotional and psychological toll that comes with living with inflammatory bowel disease. Many people experience grief for the body that they used to have, the version that didn't require planning every meal, mapping out bathrooms, or calculating energy reserves before saying yes to plans, or feeling like you are constantly letting everyone down when you have to cancel. That grief, it isn't linear. It can resurface at any time, during flares, milestones, or moments when the disease steals something small but very meaningful. There's also deep frustration with the unpredictability. Symptoms can change without warning, making it hard to trust your body or make commitments. This uncertainty can lead to anxiety, hypervigilance, and a sense of lost control, even when the disease is clinically stable. There are so many times when there are things that I want to do, but I just don't have the energy. On top of that is the emotional burden of explanation. Repeatedly justifying cancellations, accommodations, medications, or invisible symptoms can be exhausting. Many patients feel pressure to minimize their experience so they don't seem so dramatic or unreliable or difficult, but they're simultaneously advocating for their care, understanding, and flexibility. Over time, this can create isolation and guilt and burnout, not because they aren't resilient, but because they've had to be resilient for so long. IBD teaches you resilience, but it also asks for patience, which itself is overwhelming and exhausting. And yet, many people with IBD develop profound strength, adaptability, empathy, self-awareness, and a fierce understanding of their own limits. Holding both truth, the loss and the growth, is part of this lived experience. One of the hardest parts of IBD is that it doesn't always look the way that people expect chronically ill people to look. You might be young, you might be old, you might be active, you might be overweight, you might be energetic, and you might be dealing with pain, fatigue, and inflammation that doesn't show up on your outside. There's a tendency to minimize symptoms, to joke about them, to brush them off, or to treat them as embarrassing inconveniences. But behind closed doors, for people with IBD, these symptoms are unnerving and life-altering. Now, treatment for IBD isn't a one-track mind. When people hear IBD treatment, it gives the impression that there's a single medication or a straightforward plan. There is really so much more layering than that. There is no cure. There is a goal for decreased inflammation and symptoms and improved quality of life. Treatment for IBD is very individualized. At a high level, treatments fall into a few broad categories. First, there are medications aimed at reducing inflammation and calming the immune response. These can include anti-inflammatory agents, immunomodulators, and biologic therapies. Some of these are oral medications, while others are injectable. The goal isn't just symptom relief, but it's about controlling the inflammation at a deeper level to prevent long-term damage, because if that's controlled, then the symptoms will resolve. For some patients, medications work well and allow for long periods of remission. But for others, treatment involves trial and error, adjusting doses, switching therapies, or layering treatments when the disease activity changes. That process can be frustrating and emotionally exhausting, even when the appropriate steps have been taken throughout the process. Second, supportive and lifestyle-focused care often doesn't get enough attention. Nutrition, stress management, mental health support, and sleep all play very important roles in how IBD symptoms present day to day. These aren't replacements for medical therapy, but they can improve quality of life and decrease the symptom burden. Third, monitoring and reassessment. IBD care is not static. Regular labs, imaging, scopes, and check-ins help guide decisions over time. This ongoing monitoring can feel overwhelming, but it's also what allows your care team to catch changes early and adjust treatment before severe complications can develop. And then there's surgery, which is sometimes misunderstood as a failure in treatment. In reality, surgery is a legitimate and sometimes necessary part of IBD treatment. For some people, surgery offers relief and stability and an improved quality of life when medical options are no longer effective or when complications arise. So it's important to understand that surgery isn't the end of care. It's a transition to a different phase of management. Life after surgery still involves follow-up, adjustment, and ongoing partnerships with healthcare providers. Across all of these treatment options, one thing matters deeply: shared decision-making. Effective treatment isn't just about what's medically available. It's about what aligns with a patient's goals, values, lifestyle, and tolerance for risk and uncertainty. Treatment decisions work best when patients feel heard and informed and supported, not rushed, dismissed, or pressured into one single right answer. There is no universal roadmap for IBD. There is only the ongoing process of finding what works for you, revisiting that plan as life changes, and recognizing that needed adjustments doesn't mean you failed. It means that the status of the disease has evolved. Now, the role of advocacy. Living with IBD often means learning how to advocate for yourself, sometimes earlier than you ever expected. Advocacy isn't about being confrontational. It's about asking questions, sharing what you're experiencing, and staying engaged in your care. Most providers truly want to be partners in this journey. Our goal isn't just to prescribe medications or manage labs. It's about helping patients heal in every sense of the word. That means listening closely, adjusting plans when life changes, and recognizing that healing looks different for every patient. Progress isn't always linear, and setbacks aren't failures. When patients and providers work together with honesty, trust, and shared decision making, care becomes something done with patients, not to or for them. Humans are complex, and IBD is complex. So, why would its management be any different than complex? If there's one thing that I hope you take away from today's episode, it's this: IBD is more than a diagnosis. It's a daily negotiation between body, mind, and life. This episode isn't about having all of the answers, but it's about sharing experience honestly, the science, the uncertainty, the grief, the resilience, and the power of partnership. Whether you're a patient, a caregiver, or a provider, the goal is the same: understanding, passion, and care that treats the whole person, not just the disease. Healing doesn't mean cured, but there is comfort in being heard, supported, and knowing that you are never walking this journey alone. Thanks for spending some time with me today. I hope that you've learned a little bit about IBD. Future episodes will continue to explore the realities of living with chronic illness, from day-to-day management and life adjustments to identity, resilience, and self-advocacy. We'll dive deeper into ostomy life, not just the how, but the lived experience, body image, confidence, problem solving, and the freedom that good education can bring. And we'll keep spending time in that shared space between patients and providers, where listening, partnership, and trust turn medical care into meaningful care, and where both sides have something important to learn from one another. However you found this podcast and whatever convinced you to stay, thanks for listening. I'm really glad you're here.